If you are a woman and you are finding it difficult to become pregnant, these are the four tests you have to run. First, ovulation test. Everybody can do this ovulation test. It is very, very simple. Ovulation test, you can get ovulation test kits during the time of that time you are expecting your ovulation, 13, 14, 15 days. You can use the ovulation test kit to monitor it. You understand? If you come out negative, if you come out negative positive, just know whether you are ovulating or not. It's very, very important. Another method you can use to check it is ovulation tracking. This one can only be done in a hospital by the use of transvaginal scan. It's a special scan. So this ovulation tracking is very, very important. We use the tracking to check whether you have a matured follicle, whether your follicle is okay or not, whether you have a problem in your ovary that can hinder your ovulation. So all these things is very, very, very important for ovulation. Remember, without ovulation, the egg cannot be released. And when the egg cannot release, it means the pregnancy cannot come. Please. Another most basic test to do is pelvic ultrasound scan. So in this pelvic ultrasound scan, the pelvic ultrasound scan will help to check your womb, is check your ovary, check everything around your ovary. You know that if you have fibroid or if you have endometriosis problem in the womb or around the womb, so if you have all these things, to get pregnancy will be very, very difficult. So I'm telling you now, if you have all this issue, go to pelvic ultrasound scan so that we check all these things. If you have ovarian cyst, if you have polycystic ovary, all these things can be detected in pelvic ultrasound scan. Another thing that can be detected in the ultrasound scan is endometritis and also an infection. If you have all this fluid in the part of Douglas, it can also show in pelvic ultrasound scan. Another the third most important scan to test to do is hormonal test. This hormonal test, we call it hormonal profile test. Hormonal profile test, or some lab call it hormonal AC. But let me just assume hormonal profile test or hormonal AC. So this hormone will help to check if you if your hormone FSH is normal, if your LH is normal, that's follicle stimulating hormone is normal, luteinizing hormone is normal, progesterone is normal, thyroid hormone is normal. All these things, even your prolactin, if your prolactin is low or high, it can also affect your infertility. So what I'm trying to let you know is that all these things can uh, cause infertility issue if you have stayed with your partner for more than 6 months to 1 year. All this when we consider it either fertile or not. So another most basic test to run is what? HSG. HSG. I know many women hear the word HSG, but they don't know what's the meaning of HSG. HSG stands for hysterosalpingography. Hysterosalpingography. So this HSG, it helps to check the patency of your fallopian tube. Patency means simply means open or closed. You understand? If your HSG is patent, bilateral patent tube, it means that your HSG is okay. Your tube is normal. Your tube is open. So you don't have any problem with your tube. But if they say bilateral non-patent tube, it means that that tube has been blocked. So, and because of the blockage, sperm cannot travel to meet the ovary for fertilization to take place. So, this block tube can also hinder you taking in. You understand? So, if you have this problem, please go to hospital and check yourself. Thank you.